a personal story is exactly that, a story of a person, whereas evidence is the story of what will likely happen to everyone else. And so I just want to remind people to always look for the actual evidence, the root study, the root story, read beyond the headline before you make your decisions about your own health.
This is the Visible Voices podcast. I'm Dr. Resa Lewis, emergency medicine and lifestyle medicine physician, medical educator, and your host. If you're new here, welcome. This show is about making healthcare more equitable, one visible voice at a time. Today, I'm joined by Dr. Darien Sutton, emergency medicine physician and medical correspondent for ABC News. Darien and I share a specialty and a conviction that health education is not limited to the bedside. At ABC News and Good Morning America, Darien covers the intersection of medicine, technology, public health, and lifestyle medicine. From weight loss therapies and FDA approvals to disease outbreaks, maternal health, and the chronic disease burden of ultra-processed foods. Dr. Darien Sutton, welcome to the Visible Voices podcast.
So excited to be here. Thank you for having me.
Darien, we're going to go right into it. Number one, a cluttered desk is a cluttered mind. Number two, take a nap and embrace naps. And number three, move every day, like running around the track.
You know, these are the mantras that my mom, a retired pediatric ICU nurse, would share with me. And it kind of became the background audio track to my life. Always remembering the key important parts, which is organize your space so that you can think freely, continue to move so that you can appreciate your body. Everything in that sense is so important. And that's really, truly how I run my life. I think many people ask because I essentially have two important jobs, one as an emergency physician and another as a correspondent. How do I organize my time? And the truth is I honestly just, number one, plug everything into my iCal and I just follow what that's going to say for the day. And I make sure that every day I can treat my body with movement and eat right and sleep well. It's a relatively boring life, but I get to do what I love. So it's exciting for me.
I talk a lot about this book, Micro Skills, and chapter 1 is Micro Skills for Self-Care. And you basically just hit on all of them because medicine actually does not model or laud or teach us how to take care of ourselves. So I love that you got some of those lessons from the household in which you grew up. Jobs can take and take and take and take. So if you don't do those things, and what I hear you speak on, tips you talk about, stories you cover are very much pillars of lifestyle medicine, determinants of health. When do you think that this awareness that not everybody gets the same messages and not everybody knows how to take care of themselves, when did all that come onto your radar?
I would have to say my first realization was training as a training resident at Bellevue Hospital. I went to medical school at NYU in New York City, and then I started my training and residency at NYU Bellevue Emergency Room. That was my first experience with medicine in general. And it wasn't a shocking experience up until I had to do shifts at the private hospital after doing shifts at the public hospital. So for those who might not understand, at least during my training, during your first year, the majority of your time was spent at Bellevue Hospital, which is a public hospital. And then after your training, after your first year in NYU, you alternate. Some weeks you can have every other day, one at Bellevue Hospital and then one at NYU, which is the private hospital. They are right next to each other physically, and you can hear the ambulance going to one hospital while you're at the other. So that's how close they are. And in that experience, I realized very quickly the importance of access to preventative care. I was treating conditions at Bellevue that I likely, many of which, will not see again just because of the extent of pathology that existed. Treating a patient with breast cancer that had exposed itself through the skin. Many people do not realize how severe a cancer can get until you've had experiences like that, mainly due to a lack of access to preventative screenings and appropriate treatment and doctors whom that patient trusted. And then going to NYU and diagnosing a sore throat and a patient asking if sitting in their personal sauna would help to get them better. In these moments, you realize how access and cost determine your outcome before your diagnosis does. For me, it was that experience that I learned through firsthand And then I learned what the definition of social determinants of health was. So it became this eye opening experience when I started my education after residency, which is real life, speaking to friends, reading the works of authors like Uche Blackstock, and realizing the significance of how all these points outside of the hospital are actually more important than anything we can do inside the hospital.
I'm going to make a Sesame Street reference. Do you remember this? One of these things is not like the other because I think most people know things are not the same, but I think there are people in this country that actually think everybody has the same access and opportunity. And it's just not the case. To your point, access to healthy, nutrient rich food, safe places to play, to pray, to go to work, etc. When you are on TV as a medical correspondent, you cover a lot of lifestyle medicine topics. The stories and what you talk about, it's a whole culmination of embargoed scientific articles, topics that you and your team think are interesting, topics that maybe other people in the building that are related find interesting. But what you cover, a lot of it is lifestyle medicine. First, let's talk about craving, food
Yeah.
noise that you yourself have shared that you're witness to. You know what people are talking about when they talk about food noise.
My experience with food noise was probably like many, an experience where you didn't have a definition for it. You just lived through it. I grew up with more difficulty with weight than the average person. I was wearing husky sizes. I was clinically obese when I was in middle school into early high school. And I was doing this next to a twin brother who had no problem with weight, who was naturally thin, who really didn't have an engagement with food in the way that I knew that I did very early on in life. I love food. This is no secret about it. It's one of my best and favorite topics to talk about. Where are we going to eat next? That's the question on my mind. And so that concept of food noise, when I learned about it, which is this constant background chatter in your brain about what you're going to eat, even though you may feel full, there's that constant thought of what is your next meal. When I talked to my brother about this, my twin, someone I was born with, he did not understand what I was talking about. I think that was the most eye-opening experience because so many times you can talk about one thing and then you don't expect someone to know about it. They don't live your life. But my twin brother has truly lived the same life or a very similar life than I have growing up, going through medical school. And it was in that moment that I realized, oh, it really was. There are these small moments in my life which really break me out of the confines of what I would say is a slippery slope of dumb. I always talk about this with my friends. Like dumb is a very slippery slope and it can be very comfortable and it's hard to get out, especially if it's helping you. And so there was this moment where I had done like so many, applied this moral failure to weight when I realized, no, there is an actual inherent process going on that we cannot control that is related to our weight. And that also is related to our environment that we live in and the access to things that we have. And so the topic of GLP-1s is so popular um, in general. And at first, I have to say I was frustrated by covering it because every time the topic came up on the news, it became a headline. And that to me felt like we were focusing on something that we shouldn't. But after learning, speaking, talking to people who have experienced their weight controlling difficulties and how they've gone through different methods, and I think I just simply think that the topic of obesity, weight, and food noise is something that we are only beginning to understand. And we constantly apply moral failure to disease, not just obesity, but everything else. And now we're just beginning to realize, oh, there are things that people cannot control, choices that are made before they can make choices that lead to these outcomes.
And you have actually said obesity is a lifelong condition. It's recognized as a chronic condition and one of the potentially preventable, reversible, treatable, along with diabetes, cardiovascular disease, cancer. I do think obesity is having its moment, and it's not just about weight, ultra processed foods, that hyper palatable foods that will stay on the shelf
Fascinated by it.
forever, and they're in the corner store. They're the quick fix when you're starving. I want to go into your thoughts, your approach to sleep. And this goes even back to your mom talking about naps and taking a nap when you're tired.
Sleep is so important to me, and I'm very militant about my sleep. Throughout my residency, I really messed up my sleep, and I think many people do. Especially training is not built for sleep. It's just that medical training is not built for that. What I think I did not realize is that that's such a critical point in your life when you're an early adult during your medical training, that your sleep patterns will stay with you if you don't make an active effort to make them better. I did not realize how important sleep was probably until 5, close to 10 years after I had completed my training, when I realized, oh, it's actively affecting my personality. It is affecting my appetite and it's affecting my overall energy. And I realized when I wasn't sleeping, I wasn't in a good mood. I was more likely to eat carbs and I did not want to work out because I was exhausted. And it took me a moment to just realize how I needed to start there before I could do anything else in my life in terms of improving my health. And so it was really being militant about sleep, taking the time to understand what sleep hygiene was, to understand exactly what made me the best, most comfortable sleeper for myself and how I could change my environment. And then I really protected it because I think also that and rest are resistance. We live in a world where it feels like you have to keep up, especially with having a platform on social media. You constantly have this idea that you need to keep up as a creator, you need to keep moving to show what you're doing, and you need to keep up in this world where we're constantly saying, I'm producing this, I'm creating this, and this is what I'm doing. And then I realized very much that that doesn't matter if you don't have sleep. So that's why I focus on all of it. It's the center of my world. And I will say that I probably miss out on things. The idea of treating your body like a house you have to live in for the next 80, 90 years, hopefully, is so important. And I treat my body with that respect. And I think that starts with sleep.
What's your take on stress and the fact that a lot of physicians with whom I've spoken say that that's one of the pillars with which they really struggle?
My take on stress is that it is a clear risk factor for negative health outcomes, and you can apply it to very much everything and anything. You know, stress when you even think about blood pressure. A lot of people, when I was younger, at least, it was a joke. It was, oh, that argument got my blood pressure up. You know, that was a common, and no one took it seriously. But truly, that argument got your blood pressure up. And if you continue to argue like that, your blood pressure is going to remain up. And not that arguing is the only cause of stress, but I'm using that as a proxy. But I just think that there's so much that we put in the community discussion that having stress increases our risk factors, but I don't think we've really taken that and applied it to reality in terms of health. And it's also such a fluid concept that it's really hard to map it down, put a square around it, and study it because everyone experiences stress in such a personal way. How do I personally look at stress? I mean, I think it's a clear risk factor, but I also believe that we live in a culture where stress, it seems as though stress is a necessary variable for the equation of good outcomes. And I live in New York, and this is an example where the more that you work, the more that you grind, the more that you bleed, the more that you sweat, it's thought that that is what is supposed to create a good outcome. And I'm going to relate this to a recent surgery I had. I had knee surgery. It was quite an extensive surgery on my bone. And I was supposed to be on crutches. I'm trying to be a good patient, but I wasn't for 6 weeks. And at the 5 week mark, I felt like I could walk. And so I said to myself, I'm going to put my crutches down and I'm going to walk because stress is going to help me heal better because my body's going to know what to do. And I saw my orthopedic surgeon and I saw the immediate disappointment and stress in his face because he looked at my knee and he said, I spent all this time doing this work. Why are you putting your body through stress? And I said, well, I thought that it would activate blood flow and lead to better healing. He said, stress is going to lead to disorganized healing. He said, peace is going to lead to organized healing.
Mm,
And that was such a simple statement
mm.
that honestly was supposed to just be a routine follow-up appointment and changed into a therapy session because I thought to myself, oh, I've been doing this. I've been living like this my whole life. Like I've been always thinking that stress leads to a good outcome. So I think that we kind of understand that it's a risk factor, but we also, many ways, value stress as a currency in our world that we live in.
And we know there are positive forms of stress, like the anxiety before you give a talk or before you
Yes.
probably go on a segment,
Yes.
sauna or people who cold plunge. These are considered potentially some positive sources of stress. But you're talking about that with which I relate, which is negative stress, and not sleeping is another example of negative stress. So I want to tie this into what I'm going to say is a time period where you decided to relieve a lot of stress. You took a break from medicine and you went and got an MBA. And I've heard you describe it as medicine maybe wasn't all that you thought it could be or would be or maybe, and you were finding your path. You have actually segued and you have your chapters where you still practice at the bedside, emergency medicine, but you also now are a news correspondent. Was that a way that you were relieving some stress and ending up forming something quite positive for yourself?
Well, when I was in medical school, we were coming towards the end of medical school, and I had the experience where it felt like everyone around me knew exactly what they wanted to do for the rest of their life. And that was a scary experience. And I didn't feel ready, if I'm being quite honest, in doing that next step. And I did not feel like signing my name on a piece of paper that was going to send me to a residency and then really define the rest of my life. I knew that something about that was not right. And so I started looking for opportunities where I could learn about the world outside of academic medicine. But I just really wasn't interested in research. And so I ended up auditing or sitting in classes at the business school, which was at NYU Stern School of Business. And because I was a medical school, I was already a graduate student. I was allowed to sit into these classes, and it was just an eye-opening experience. One of the first classes I audited was by a professor named Scott Galloway, who is so interesting because he's now on TV, being Scott Galloway. But I remember him in my first experience when he was teaching about the world of strategy, the world of marketing, the world of business, and how it applied and how people made decisions. And I quickly realized, I said, oh my, healthcare is one of the largest economic markets in the world. When you compare it to other countries, healthcare in the United States, one of the largest economic markets, and it would be such a disservice if, as physicians or as a physician, if I really wanted to think about how I could change this world, to not sit into these classes and understand how people look at business plans and people buy things. Because at the end of the day, healthcare is in many ways something that people are wanting to attain. We would hope that people have access to it without the cost, but the reality is that the United States healthcare system is a business. And so I just thought that going to business school would help me to understand how one of the largest businesses in the world operates. And it really did change my perspective. I realized how much I did not know. Every day I went to class in business school, I was shocked by how much went on around us and how these decisions were made about the choices that people would most likely make. And then I thought to myself, wow, there's so much of out of the box thinking in this business school. Whereas in medical school, we all kind of learn the same way. You learn how to see a patient, how to communicate a patient problem. You discuss your research in the same way. And because you need that organization to move fast, to get ahead. But in business school, it was this world of creativity, and it really changed my whole perspective. And then I brought that back to medical school and realized, oh, I actually love medicine. I just need to look at it differently.
You can design your life. You can design your
Yeah.
professional journey. I love that.
Yeah.
I love that. Let's talk about the piece of your life where you are a news correspondent. Behind the scenes, I'm wondering, what is your pre-game prep? Like, how do you get ready for an episode when you're on camera? What does the research look like with your team?
Well, the research often starts first with the topic, and then the topic then leads into what, from my perspective at the very least, what education can come out of this topic where someone at home might, number one, obviously learn about this topic, but what background is needed in order for them to understand why this is important to understand. And so many times, a lot of my work involves, okay, how can I put myself in the patient perspective, the patients that I treat in the emergency room, which is why I continue working, because it always gives me that perspective. And how can I lay this out so that as many people as possible can understand what this means? I love the news. I watch a lot of it. And I often watch many medical segments that are done by doctors and many that are not done by doctors. And I watch it with a critical eye because I'm always curious, does everyone understand what this person is trying to say? I clearly do, but I've spent most of my life now in medicine. So I have to
You
be
speak
aware of
medical.
the fact that I speak medical. So I watch it critically to really identify how much of that is truly understandable to the person who has never stepped foot in a hospital. And that's not even dependent on whether or not that person has a high level of education, because I've met lawyers who don't know exactly what a colonoscopy is. So it doesn't mean your health literacy and literacy overall and education are not directly tied. And so So a lot of my preparation goes into making sure that whatever we are about to talk about has a basis of understanding with as many people as possible.
Do you get a little bit of positive stress before segments?
Oh, a tremendous amount of positive stress. I revel in it. And I have to say that before a segment starts, a little voice in my head goes, "Why are we doing this?" we there's so much stress that I really don't. And it's so interesting because I've been doing this now for close to 6, 7 years. I started as an intern at ABC. Actually, close to 10 years. I started as an intern at ABC in 2017. So I have been in these studios, I've been around these cameras, and I still get incredibly nervous, mainly because I want to make sure that what I am about to say is as understandable as possible. And I don't get nervous about the content because I can talk about it. But what I get nervous about is when I'm done with this, will everyone in this room understand? And a lot of my work, or a lot of my the way that I get feedback, I'm not looking at necessarily the anchors. I'm paying attention to the cameramen, the technicians. I notice that when I speak in a way where I'm really working on and making sure that it's understandable, I notice all the cameramen, they took off an earphone and they said, "Wait a minute, blood pressure is something you can't feel? Wait a minute. You're telling me that dementia is a result of stress? It can be? Wait a minute. You're telling me 40% of cases of dementia are preventable?" I love to see their response. And so that's a little bit of my mini audience. And then I go back and I look at the comments, which they say you should never look at, and I read all of the responses to make sure and see if I could spot that people can see that I'm trying to be understandable.
It means you care, but also, arguably, we as emergency physicians are primed a little bit for this in terms of communication because we see and take care of everybody in the emergency department.
Yes.
For people that are listening, the physicians, the healthcare professionals, why do you think it's important that we are in these places speaking on social media, correcting misinformation?
There is so much online that is not based in fact that it is quite honestly scary. And I think that in medicine, when I was first starting my career, participating in media was not seen in a positive manner. When I was in residency and in medical school, I knew that I wanted to create a platform where universal education was the center of my work. And I knew that that involved being digitally active. And I remember that I had professors and mentors who really didn't take it seriously. I completely understand in many ways because I myself, I was, what's the word? I was convinced that this was going to be my career very early on.
No.
And so for me, I had all the confidence, but I remember having the conversations where people would say, "Well, aside from that hobby that you're doing, what else how are you going to do real medicine? How are you going to practice real patient care?"
Why is it important that doctors are in this space?
So what I'm trying to say is that I started out where this wasn't taken seriously. We've seen nothing but a growth of misinformation and a lack of accurate reporting online. And now we've come away with a culture in medicine, which is unfortunately adapting slower than everyone else because of the way that we work. And I think now is it has never been more important. And I mean, yes, every day feels unprecedented for many reasons, but it has never been more important for people who have the background, the education, and the training to learn how to use these tools to communicate with our audiences, because we can't just sit back and say, "That's false, that's not real." We have to actively engage. And so a lot of my work and my thought is, how do I engage with quality, not just quantity? I want to make sure that what I'm producing is helpful.
And you have emphasized the importance of being authentic to yourself, that you have to be your first and biggest fan of your work. And
Absolutely.
I had a podcast episode with a professor of communications, Claire Wardle, and she said it is really important that physicians and other healthcare professionals are online, social media, in these spaces because of misinformation. And that kind of switched on a light for me. I'm so glad you've been doing this for as long as you've been doing it. When did you realize you had a voice and when did you start using that voice?
It was during residency. I would come out of residency in Bellevue Hospital, and many times I would walk home in silence, just trying to take in everything I had just experienced. It is an experience that I'm so grateful to have this experience, but it really does throw you into the water. Residence throws you into the water. You are just it is remarkable how different people live. I just have to that and so I think that was a large part of my thought process. And I would sit at the bus stop and I would think to myself, how can I explain something that I learned today to the everyday person? And that's where this concept called Bus Stop Med was created. And I used my platform online, me and a couple hundred of my friends who had didn't decided to go to medical school, but were still interested in what I was doing. I took that as an opportunity to teach all of my friends about what I was learning, but I was making sure that I was teaching in a way where they could understand, even if they didn't like the science classes that we took. The responses that I would get from that, although it was a small platform at the time, were so inspiring because I could tell that people really wanted to know what was behind the curtain in that emergency room. And I knew that they wanted to understand because we all had bodies at one point. We all want to know how they work. And creating cases and stories where we can explain it in a way where it can be followed, I thought was so I found that my friends were learning. And then we would go out and they would tell me like, they would use a scientific word or a medical word appropriately with me. And then they would say, I learned that from you. And that was an experience which was the seeds of what I have today, which is, it makes me feel so good when I can see someone say, oh, I understand now. That feeling, I can't even describe what it feels like to me, but I always search for it. It's like a drug.
Yeah. Yeah. I'd love to leave our audience with three micro skills, three small actions that they can take to be more informed, to understand more about their bodies and their health. For doctors and medical professionals that are interested in putting their voice online, on social media to help combat misinformation, what's one action they should take today?
I think my advice would be, what is your story and how are you going to relate that story to others? I think so often we think that we're living a life that is not relatable, that we can't connect with other people. I think taking time to understand what is important to you, what is your story, and how you can relate that to others is a really important place to start. I personally am old school. I start with writing. I think that one place to start before you hit record is write your thoughts down on what you think is important. Write your thoughts down on conversations that you continuously have with patients that you wish many people could listen to. And then you can think about how to create content. And that can be in any form that you think would be helpful and relatable so that you don't have to have that conversation 1,000 times.
For the audience members that are interested in learning more, getting some comprehensible health education, learning about their body, and some of the lifestyle medicine pillars we talked about today, where would you send them?
I would be remiss to not say follow ABC News Medical Unit. We are always covering the most up to date stories. The one thing that we stand by in our office that I'm so proud of is accuracy. There are so many moments when there are stories that seem provocative, engaging, and likely going to be viral. And we realize that there's no scientific basis for it. And if we were to produce something about it, it would likely lead to more misinformation. And so we make important choices there. Validated resources are so important. I think the organizations, the American Heart Association, the American Diabetes Association, the American Pediatrics, the American Academy of Pediatrics, I think that there are wonderful organizations that we need to support. And I think that they really do provide brilliant education that is often underutilized. I worked in California with many new moms who had toddlers and 5-year-olds. And one thing I noted in between our patients, they would be reading these journals about childcare, about screen time, and they were so ahead of what the risks are because they were sitting down and doing the research and treating it like a project. So I would say look to those validated resources and start. I think starting there is really helpful and important.
For people that really interest was piqued based on our discussion of food as medicine, obesity as a lifelong chronic condition, and GLP-1s, there's a lot of information out there, and we're learning more and more in terms of doses for women. We're looking about doses based on your weight, talking about cancer. Where's a good place to start?
Those same organizations I discussed are also doing active research to understand the benefits and the risk of GLP-1s in our world and how we use them in medicine and healthcare. It's because, to be honest with you, I often see a tremendous amount of research where they're using GLPs to understand how they affect inflammation and the outcomes of health in general. The one thing I have to always caution people about is that the majority of the work you see about GLPs, or you might be seeing on your timeline, often are marketing. They're often advertisements, and they're often personal stories. And I just want to say that those are not legitimate sources for you to get that information. When you see celebrities, when they're positioning themselves with GLPs, for example, we always have to understand that they have extreme levels of privilege and they're likely getting funding and they have another reason to create content to engage you. It's not necessarily to educate. And I also want to remind the audience that a personal story is exactly that, a story of a person, whereas evidence is the story of what will likely happen to everyone else. And so I just want to remind people to always look for the actual evidence, the root study, the root story, read beyond the headline before you make your decisions about your own health.
Darien, what should the title of our episode be?
What would the title of our episode be? Two ER doctors having a conversation about the health outside of the emergency room. You know what I would actually say that the title would be? A term that I love to ask is keep asking questions. I think that as physicians, that term is so important to me because so many people feel closed off and not able to ask questions to us because they can feel fearful. They can feel that they're being judged. They can feel that there's bias in the world. I think as physicians, if we continue to remind patients to keep asking questions, and if it comes from physicians, it is so valuable because it doesn't matter what exists unless you understand it. So keep asking questions.
Keep asking questions. Dr. Darien Sutton, thank you so much for joining me on the Visible Voices podcast.
Thank you for having me.
The Visible Voices podcast amplifies voices in the healthcare, equity, and innovation spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis, MD on social media, or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by hosts and guests are their own and do not reflect those of their employers or institutions. Guest appearances do not imply endorsement of any product, service, or organization. Information shared here is intended for general informational purposes only, reflects the time of recording, and should never substitute for clinical judgment or individualized medical advice. No physician-patient relationship is created by listening to or watching this podcast. Together, we're making healthcare more equitable, one visible voice at a time.